Coming up on Lifestyle Magazine, the top 10 questions from our viewers to Dr. John McDougall. And now, here are your hosts, Mike Tucker and Dan Matthews.
Thank you. Thank you so much. Appreciate it. Hey, John. This is going to be a great show, and you at home might want to take notes or TiVo this. We're doing the McDougall Top 10. 10 subjects in quick form that you, our viewers, most want to know about. So, John, you ready for the top 10 questions?
And just remember, John, we got to get 10 in.
10,
we can't
yes.
stop at 1.
No, we'll get 10. I'll be brief. Is that what you're saying?
All right.
But first of all, before I answer them, you must realize that the things I probably will answer will be different than what people believe.
Okay.
But consider what
So
people...
why should I be surprised?
Well, the thing is... Yeah, I know that. The thing is that what people believe has gotten them in the shape that they're in right now, where, you know, 2/3 of the population is overweight. Over the age of 30, almost everybody is on medication, has an elevated risk factor for disease, like heart disease or stroke, or they're just downright sick over the age of 30. So something's wrong. So when you hear my answer, you go, oh, I know that's different.
Yeah.
Everybody else says it's different. Well, sure they do. But look at what's happened with what they say.
First question, diabetes.
What about diabetes?
Well, they just want to know what causes it, how can I treat it?
Diabetes.
How can I treat it?
You know, there's two types of diabetes. One is type 1, which is where the pancreas is destroyed. And what the scientific research says, and what I wholeheartedly believe, is the initiator of that destruction, it's an autoimmune disease, is cow's milk protein. In other words, the protein that's in your skim milk and your cheese. That's what initiates it. And of course, we feed little babies, human babies, cow's milk, and that's how they initially get exposed. Type 2 diabetes is due to overnutrition. Too much fat, too much sugar, and so on. Completely different diseases, just they have in common that the sugar goes up.
I don't want to go too far with this, but type 1 is that caused by cow's milk.
Yes.
Everybody must not have a predisposition to that, though.
No, it's just like everybody that eats beefsteak doesn't have a heart attack. You know, and, we have genetic differences, of course.
However, but somebody,
bad luck, good luck.
somebody might not know whether they have a predisposition or not.
And, you know, people use that excuse, too, Dan. They say, well, what if I'm not genetically susceptible, or it's not in my heredity, or let's test my genes.
Yeah, that's right.
Let us know so I can find out what I have to avoid.
What I can get away with.
But if you look at you know, your parents, your grandparents, the people around you, once they pass 30 or 40 years old, I mean, they may not all get heart disease, but if they don't have heart disease, they're fat, or they've got a stroke, or they've had cancer, or they've got constipation, or I mean, they're all sick. So your genes must be working against you.
Thank you for not holding back. Question number 2, arthritis. How can I deal with it?
Oh, arthritis, again, there's all kinds of forms of arthritis. There's the wear and tear arthritis, and there's the inflammatory arthritis. And the inflammatory arthritises are things like lupus and rheumatoid arthritis and psoriatic arthritis. And these joints are really hot. They're inflamed. And again, there's a cause for this. It's not just like bad luck or the wrath of God or, you know, bad genes. There's something attacking those joints.
Right.
And in the case of these inflammatory arthritises, it is initiated by the food. The food that you eat, and you know, there have been studies, there are over 25 studies published, and I have a collection of these studies on my website, over 25 studies published that show that the rich Western diet causes these inflammatory arthritises, and if you change your diet, eliminate the dairy in particular, the fats, that you can cure these problems.
Wow.
You know, with his reference to his website, I think that would be very instructive for viewers to know it. Give us your website.
It's drmcdougall.com, which is spelled DRMCDOUGALL.
Okay. Question number 3, you ready? We want to know about garlic. Are there health benefits of garlic?
There are. There are health benefits. Garlic has some sulfur compounds in it that have been shown to lower cholesterol and lower blood pressure. And there's even some deodorized garlics that people can take because, you know, they're offended by the odor. Yes. I don't mind. In fact, you know, I wouldn't discourage somebody for using garlic as part of their health program. But the thing I get concerned about is when garlic and other supplements become the center of their health efforts. Versus changing their diet. Okay. You know, you want to make a spaghetti dish, low-fat sauce with garlic in it.
Yeah.
You know, you don't want to eat bacon and eggs and squeeze garlic
on
over the top.
it,
You know?
yeah.
And that's what my concern is that people are looking for the pill.
Would that
garlic.
taste good even? I don't know.
But the point is they want a quick fix, and there are no quick fixes. You have to deal with the underlying issues. And yes, garlic has some positive things. Onions do too. And you know, we've always talked about carrots being good for your eyes. I mean, all these things have a little truth to them. But the fundamental truth is you need to get the diet right, exercise program, clean habits.
Okay. So it's not just the pill, but we're talking about a lifestyle issue. We're talking about diet. We're talking about exercise. All right. We're going to be right back with question number 4.
More questions for Dr. John after this.
You surprised me. I didn't know those questions.
We're back with the McDougall Top 10. I'm going to ask Dan to share question number 4 with you.
Well, I got to tell you, John, this is big fun getting to be here with you.
All right, thanks, Dan.
And particularly kind of getting you on the hot seat because you don't know what we're going to ask you next.
No, I don't.
We know now that a big deal is diabetes and arthritis. And I loved your little takeoff on garlic. I used to think that an apple a day keeps the doctor away, and garlic every day would keep everybody away. That's the reason it's so good to you. But we come now to the issue of depression. There is lots of people who are sick about being sick.
Depression is a big issue. I mean, most people can relate to a few blue days, but there are some people that get so bad that it destroys everything around them. And the answer, unfortunately, to depression is the pills like Prozac and Effexor and these antidepressant pills. And a good share of the population is on them. I mean, I've been in patient settings where 30% of the women were taking these antidepressants in patients that I was seeing. Now, there are, you know, it's not that some people wouldn't benefit from these, and they do help some people, but I mean, this is not like the classic novel 1984 where everybody's on drugs. Is it yet? It is.
Well.
You know, I mean, it really, and it doesn't have to be there. There are some simple, non-toxic ways to deal with depression. I'll just give you a couple of them. One is to eat well. You may have heard of the book, Potatoes Not Prozac. If you eat a healthy diet, the right kind, you know, lots of carbohydrate, then serotonin gets in the nervous system, relieves depression.
Gotcha.
You may have heard about sunshine helping with depression. In fact, people use these light boxes. So it relieves depression. You may have heard about exercise, the runner's high. That will relieve depression. And one of the most powerful things that very few people know about, completely cost-free, completely side effect-free, is to control your sleep. Too much sleep causes depression.
Too much?
Yes, and people can relate to this in 2 ways. One is they can think about on the weekends when they sleep in a little extra. Kind of the whole day goes blue. Or the second thing is you remember the days of college when you pulled all-nighters. After the second day or so, you were manic.
Yeah.
Okay, so what happens is when you sleep, you create a depressogenic substance. It causes depression. And in our society, we're taught the more sleep, the better. Beauty sleep. Get 8, 10, 12 hours sleep. And this induces severe depression in people. Studies done in the 1970s show you can take people who are potentially suicidal. I mean, these are really sick people, very depressed. You deprive them of 1 night's sleep, and 70% the next day are completely free of depression.
You've got to be kidding
No,
me.
it's published in the Archives of Psychiatry.
That just runs absolutely counter to everything I've ever heard.
But that's what I'm trying to tell you. That's why people don't get well. So here's your routine. I mean, they stay sick.
Okay,
and believe me, there's economics behind this. You know, there's no reason to teach somebody to get well. There's every reason to teach them to get drugged. Now, here's your routine. Okay, we're putting all the things together I just said. You go to bed at night, you set your alarm clock so that you only get, say, 6, 7 hours sleep at night. You get up early in the morning, so the sun shines there. You go for a walk, you come back and you eat hash brown potatoes. You have just used the most powerful thing there is to relieve depression.
That's wonderful.
Yeah, I'm just watching this audience, Mike. These people are actually listening to things they've never heard before. And you're impressed, right?
I believe it.
Thank you, John.
Thank you.
Hey, a thing we talked about years ago, and it's still out there, dental amalgams.
Yeah, dental amalgams, the FDA would never approve them again. I have some. I think I still have a few left. I would encourage no one to ever have them put in again, even though some dentists still do it. Most of them have kind of given it up because, I mean, this is mercury. There's a combination of toxic metals in this substance that's put into the tooth. But if you already have amalgams, I don't encourage people to have them removed. And the reason is removing them releases a lot of mercury. You can destroy perfectly good teeth. So I don't recommend that kind of intervention, even though a lot of people think that all kinds of illnesses come from these amalgams.
Yeah.
And maybe in some cases they do. But don't have new ones put in. Have gold or porcelain used instead.
Tell me about the benefits of herbs.
Well, herbs are, you know, I mean, half of the good drugs, in fact, more than half the good herbs, but half of the drugs doctors prescribe today in modern medicine are derived from herbs. For example, aspirin comes from the willow tree. Vincristine digoxin comes from the foxglove plant. Vincristine comes from the periwinkle plant. That's one of the most potent anti-cancer drugs we have. So we have all these medications. Some of our best medications came from plants.
So you would endorse going to the original source?
Well, in some cases, I think herbal medicine, as long as you consider it as medicine, it's not natural. These are drugs. They have benefits and side effects. They have risks. They just happen to be a lot riskier than when you take the natural medication and you refine it into something. Then you end up with a lot more potent medication, which has a lot more side effects. But of course, you can't patent a foxglove plant.
Right.
But you can patent digoxin.
Okay.
You know, it becomes a big selling drug. And there are certainly some advantages to doing refinements, but there are some risks too. So yeah, herbal medicine is potent medicine. Every doctor in this country, in the Western world, uses it.
But original herbal medicine, it is a multi-billion-dollar industry today, and people will go to buy the herbs maybe rather than to go talk to you.
Well, you know, they do, and there are some herbs that I feel pretty good about recommending to people. Like, for example, saw palmetto, when people have prostate enlargement and difficulty emptying their bladder. St. John's wort, I think, has been shown to be effective with depression. It can be a benefit. Licorice as an antacid for people. So there are, I mean, these are real drugs, and I think, you know, if you want to get down to the bottom line, I think doctors should be educated in medical school more about using herbal preparations for their patients. But again, the economics aren't there, and it's not going to happen.
Talk a little bit, if you would, about naturopathic medicine.
Well, you guys sure think of some
That's good,
interesting
isn't it?
things.
Weird stuff, huh?
Yeah, well, you know, being in, quote, you know, I hate to think of myself as an alternative medicine doctor or a holistic doctor, because I'm not. I'm just a general practitioner who uses basic stuff to take care of people, mostly diet and lifestyle first. Medications are last, but I do use them. Alternative medicine can mean all kinds of things, all the way from, you know, chiropractic medicine to, you know, people would consider me an alternative medicine doctor. I do think we need an open mind, because what we're doing now does not work with chronic disease. It works with acute diseases. We do wonderful, you know, with accidents and infections. When it comes to chronic disease, just the word chronic says it doesn't get better. So we have to have an open mind. So whatever alternative medicine may be, you know, we need to look at it, because there are certainly some of them that are very good, and patients aren't getting the advantage of it.
Hey, you've done very well so far. We're going to have 3 more to go, but first we're going to take a break.
I'm a little worried. You guys have done well, too.
Well, 3 more to go. We're going to come right back after this.
More with Dr. John McDougall after this.
And we're back. We've been dealing with John McDougall's top 10 questions. And so, Dan, why don't you take the next one?
Well, Dr. McDougall has been a great friend of Lifestyle Magazine for many, many years, and we'd like to have you back, John, because you give us a different perspective on things that's so basic and practical to where we are. More and more, we are all confronted with the reality of cancer. People who have been perfectly healthy, and all of a sudden, we have this tragic diagnosis. And I'm thinking of one that's very real in my life at the moment, where a lady who has been suffering from lymphoma and all kinds of efforts, modern medicine to treat, and doing well, and lo and behold, a downhill slide, and the new diagnosis is she's suffering from leukemia as well.
I would have guessed that.
And so, what's our cancer battle plan?
Well, you know, we set out a cancer battle plan. What Nixon set out wanted to eliminate or decrease cancer by, what, 2000? You know, that was the war against cancer. And actually, the risk of getting cancer has increased.
Increased,
you know,
yeah.
not decreased. We're making some fronts, like on cigarette smoking and lung cancer.
Right.
So we're making some strides there. But we really need to deal with other issues that have been largely ignored. Pollution. For one, chemical pollution of our environment is a huge thing when it comes to cancer, and probably is at the root of initiating a good share of our cancers and promoting them, are these toxic chemicals. But the way these chemicals get into people is through the food. Right. And as you move up the food chain, from the grasses and grains to the cows, you know, as you move up the food chain, these chemicals get more and more concentrated. And so, one very practical step to reducing your chemical load is to eat lower on the food chain, eat the plants. And that will help a lot too. Plus, you hear about antioxidants and fiber and low fat. Well, those are all in the plants. So that's another way you deal with preventing cancer. Now, I have to just kind of get a little bit off topic here, Dan, and that is that there's a cancer business out there, and it is fueled by early detection. Okay, this is the means. Okay. Now, I'm a doctor. You guys are potentially patients. There are two ways we can establish our relationship. One is you can get sick and you can come to me. You can ask for help. When I give you help, I don't have to have a lot of evidence that it is useful because you ask for the help. Right. But what if you're just having a great time? You're enjoying your wives and your family and your work and everything's wonderful, and I come looking for you. That's called screening. That's mammography, breast self-examination, PSAs. I better be darn sure I'm going to do you more good than harm, don't you think?
That's right.
Well, see, we have all these screening programs out there. They are making healthy people into patients. And the scientific research says their benefits are limited. And, you know, we can go into some details. I'll tell you, I think, you know, pap smears are good. One colon exam is good. Look at your mouth for changes called leukoplakia. Look at the skin for melanoma type issues. Right. But most of the stuff with mammography and breast self-examination and prostate exams and so on, these things are of limited benefit and great harm to people. We should be not putting the money into collecting business by screening, but into changing people's diets and lifestyle like we did with cigarettes. Right. You know, we made a difference. We don't go get chest x-rays on people to prevent lung cancer. We tell them don't smoke. We shouldn't be going and getting mammograms and prostate blood tests on people. We should tell them not to eat that high-fat, high-animal product, highly contaminated diet. But that's not where the money is.
But let me tell you, I just got a broadside from Johns Hopkins, and they are telling us that we ought to watch our diet to prevent prostate cancer.
Yeah, absolutely. Wow. And you know, the American College of Physicians, the American Academy of Preventive Medicine, they've all come out and said don't get PSA tests. You know, so there are some bits of truth that surface there to help the public. But what you need to know as the public is it's up to you. Nobody's going to come and save you with early detection or treatments. These things are not good with few exceptions. You're going to save yourself by your diet and lifestyle, and that's where you need to focus your attention.
Okay. All right. We come back to that same issue again, don't we? Over and over again is always back to diet with you.
Well, you know, if the pills worked, if the way we were doing things worked, we would look out and we'd see all these healthy people just enjoying great lives. That's not what we see. We see a lot of sick people suffering unnecessarily.
That is true. That is true. Tell me a little bit about vision therapy.
Oh, come on. I've never even heard. What is vision therapy?
I have no idea. It's down on the card. People have asked us about this.
This is a trick question.
You think it is?
I don't know.
Oh, come on. You and I have talked about that before.
Iridology?
Yes.
Yeah, we did a show. We really embarrassed that guy. Remember?
I know.
That was a show we did with an iridologist. That's what you're talking about. We did a show with an iridologist, probably 15 years ago, Dan. And we had the person on the show, and I pointed out a study where they took patients with kidney failure. And, I mean, these people were on dialysis. And they took pictures of their irises, and then they took pictures of normal, healthy people, and they mixed them all up, and they gave them to iridologists, general doctors, and so on, and said, identify the people with kidney failure. I mean, kidney failure is really a sick situation. And they couldn't tell the difference. They couldn't tell the difference. So, I mean, iridology, I mean, I don't see the science behind it, if that's what you mean by vision therapy.
Well, but there's, and I'm not sure what the question,
I don't
see
either.
the question either, but how do we take care of our vision?
Well, thank goodness we're born with good eyes, but eating well makes a big difference. The number one cause of blindness, preventable blindness, is diabetes. And we've talked about diabetes. That's a dietary issue. So I would say that's a major thing. The other thing is, just general hardening of the arteries gives you something called macular degeneration. That's how you get macular degeneration, is you close the arteries to the eye, the macula. And so there's clearly the two most common reasons to lose vision are caused by what we eat.
Again, with the degeneration, there are vitamins that they sell you?
I know they do. These are
what
things
about
that
those?
comes from plants. Well, it's a sidestep. It's not dealing with the cause of the problem. The cause of macular degeneration, the cause of diabetic retinopathy, particularly in type 2 diabetics, is what we eat. And that's where we need to focus our attention. But, telling somebody to eat potatoes and rice and corn and beans, I mean, what do you get out of that? Hey, I can sell you a pill that I can make 1,000 of them for $1, and I can sell them to you for $10 a piece, or $2 a piece anyway. Where's the business?
You've got a point. John, thank you. We're going to take another break. We're going to come back with one more question, but thank you. We'll be right back. We've been having a wonderful time with good friend Dr. John McDougall. And we're down to the final question. And Dan, would you pose that to him?
Well, this brings me back to earlier shows we used to do, John, as well. The issues of PMS and menstrual problems.
You really want to get into that?
Yeah, that's the reason we saved this. We only have about a minute and a half left.
Actually, I don't know how you guys thought up about these questions. Well, let's just talk about female reproductive health in general, and PMS as part of it. It's a sad situation in our Western societies, in our country, that women are sick. Just like men, women are very unhealthy because they're fueled improperly. And as a result, they take in foods that create hormone imbalances, in particular high estrogen levels. From the foods that we eat, from the estrogen they put in the meat, from the fat that creates estrogen in the body, the lack of dietary fiber, you get these huge estrogen levels. Estrogen stimulates the breasts, so the breasts get tender, they get painful. That's part of the premenstrual syndrome. It stimulates the development of the endometrium of the uterus. That's the lining that a woman develops every month and then sheds it at the end of the month. When you have too much estrogen, you make that lining too thick, so she bleeds very heavily, has lots of pain and clots. It's from the overproduction of estrogen from the food. And then you have the emotional issues that go along with PMS, which are, again, hormone issues caused by the food. Studies done by a guy named Richard Wortman at MIT back about 30 years ago, he and his wife Judith. I did studies on PMS, and they put these women on high carbohydrate, in other words, rice, corn, potato diets, and they relieved their PMS symptoms, and they published all that.
Well, I hate to stop, but we're out of time. We really are. And I want to thank you for watching. If you'll contact us via the information you see on your screen, we will be happy to give you John McDougall's All-You-Can-Eat Vegetarian Cookbook. Check us out on lifestyle.org, and we'll see you again later. Take care, Dr. John McDougall.
For more information on this or any Lifestyle Magazine show, you can write us at Lifestyle Magazine, Box 1000, Thousand Oaks, California, 91359.
You really want to get into that?
Yeah, that's the reason we